Today we're going to be talking about lessons from residency. And I'm very excited to have on with me Dr. Sarah Kahn. How you doing, Sarah?
I'm doing great. How are you, Dr. Fisher?
I am doing very well. You are almost done. You're in your last year of pediatric dentistry at Maimonides Medical Center out in New York. Tell us a little bit about what's going through your mind right now as you've just entered the stadium and you can see the finish line in front of you.
So I'm definitely very excited. And studying for the boards has actually been fun, if I want to say that, because I'm able to apply the things I'm reading in my textbooks and the literature to what I'm seeing with my patients. So it's nice to make that clinical correlation.
In your residency, was it difficult for you to get to use new product, innovative products, things that aren't readily, that are kind of considered more cutting edge technology? Was it hard for you to be able to do that? And what was your experience being able to use Easy Crowns? Were you able to do that in your residency?
So I think as far as new products, as everything we do, it has to be evidence-based. So as long as we were able to talk to our attendings and our program director about new products and present the literature and the evidence that proves that it is something that's good for our patients, we were able to do so. And I want to say actually 2 months ago to this date, we actually had a hands-on Sprig course in our clinic, and that was really, really wonderful. Our residents and our attendings, everybody enjoyed it, and we've been trying to encourage one another to use those skills we learned and practice those skills on actual patients.
So was that the first time you guys were able to use the crowns in the clinic?
Yes, we were actually able to use the crowns in the clinic. And I think because we're just starting, we've been using the crowns in the OR. That way we don't have to worry about, behavior management, and we can just focus on trying to do the best clinical job we can.
For our resident listeners that are listening, anything that you look back and wish that you had done more or had more exposure to?
Absolutely. That's a very good question. I was actually talking to some of our first years about it earlier this week. And I think you have to take every patient opportunity as a time to learn. I feel like sometimes when we're doing recalls, you're kind of just breezing through the recall, trying to get ready for that op or the emergency that's coming in. But recalls can be a great chance to learn. So anything you see as far as a syndrome or a pathology or even a unique treatment planning situation, take the time to talk to your co-residents about it, take the time to read about it, and going forward, those things actually stick better in your brain and can help you with future patients.
What has been your biggest challenge clinically going through pediatric dental residency?
One of the biggest challenges I think has to do, kind of ties very well to Easy Crowns and Sprigs, is talking to parents about stainless steel crowns and how they're needed, or a full coverage restoration, especially when caries are pretty extensive. And it's great that there's now an upcoming product and a technology that can be better well suited for patients and parents that have aesthetic concerns as well as concerns for keeping, the gingival tissue healthy around the crown.
You had mentioned in the beginning that a lot of the residency programs, they really want to go evidence-based. And I think that's one of the things that's exciting to me is that we've been on the market now for over 10 years. We've had phenomenal success. So the evidence now, I think, is there not only in the clinical dentistry, but in also a lot of studies that have come out through different universities on different zirconia products. So we're excited that you guys had the opportunity to be able to at least be exposed to Easy Crowns before you get out of residency. Thank you so much for being part of this little series. I look forward to being able to see you hopefully at an upcoming meeting. Hopefully as we start to open up again and you get out in private practice, we'll be able to see each other at a show. But thank you so much. Thank you also to our listeners for watching. If you have any questions or clinical challenges or just want to ask something, feel free to reach out to me at ask Jeff at sprigusa.com. Thank you.